Good afternoon, all. In this section, I will be explaining about various study techniques that you can utilize for your anatomy exam preparations. So we'll start with the human body. The structure of our body, that is a human body, which approximately measures about 160 to 170 centimeters in length, 35 to 40 centimeters in width, which consists of about 11 body systems, is 78 internal organs, and 30 to 37 trillions of cells. Before learning the structure of this body, you should remember one thing, that in just 1 or 1.5 years, you can't finish learning this and be perfect in this. That's why we have 3 years of master degrees. It's applicable for each subject, not only in anatomy. And a doctor's life is like a continuous process of learning. After your studies, when you become a practitioner or a teacher or both, you will gain knowledge from your patients and students than what you studied for passing in your exams. So as a first year student, no need to worry about I'm not perfect in anatomy. Because if you take a single system, for example, neuroanatomy, that itself need more than a year to finish studying. Fine. So your prime responsibility is to earn the basic knowledge about the human anatomy. That is the foundation of your upcoming growth as a doctor. So it's just the first step to enter into the medical field. And your second responsibility is to pass in your exams with good marks, right? Hope you know the importance of learning anatomy. That is anatomical structures and its relations. For example, in future, a patient comes to you with a scan report which showing gallbladder stone or cholelithiasis. Then you must know the structure and relations of gallbladder and extrabiliary apparatus. You know that the gallbladder connected to liver, pancreas, duodenum, etc. So if any block in the gallbladder, it will primarily affect the proper functioning of all these related organs. Without having all these basic relations or basic knowledge about the relations, you can't be successful practitioner. So that's the importance of learning basics of anatomy. Next point. So we will come back to the study techniques. Before starting, there's one more point. You should remember that it's never late to start studying for your exams. Still, you have enough time to score good marks if you study systematically and sincerely. Fine. Then the very basic problem facing by all the first year students is memorizing anatomical terms, right? Especially related to the nervous system, not only the nervous system, but there is your main issues comes in case of nervous system. There are around 8,000 anatomical terms to learn in order to understand the structure of the human body. In this, you have to know at least half of the terms to learn the basics of anatomy in your first year. Still, learning and memorizing all these terms in an year is never an easy task, right? Every student having some common and different issues while studying the anatomical structures. Some having issues with memorizing the measurements, borders, surfaces, blood supply, and nerve supply, etc. When you are studying about one organ, for example, stomach or lungs, you will think that it's very easy to understand. And that day you will think that I'm perfect in that organ. And next day, when you study some other organs like pancreas or spleen, that time also you think the same. Like you will feel like it's very easy and I understood everything. But while memorizing the previous day's topic, the real problem starts. You will mix up the borders of pancreas with the borders of stomach or spleen, or confusions with the artery supply, right? And when you complete study 5 or 10 organs, then things will get more worse. like it will be a complete mixture of body parts. For solving such issues, some charts will help you than paragraph notes. It is not late to do all these basic things. From today onwards, if you spend half an hour a day, you can easily finish it within a month. Okay. But not copying from your friends, that is like cheating yourself. So do it in your own way with the help of your class notes and textbooks. Fine. You can do it in a new notebook, and some charts look simple but really effective. I'll give some examples. Start with the list of organs present in each system. Hope all of you know the mnemonic for learning the body systems, which is Mr. Lee Crusent. M for muscular system, R for respiratory system, L for lymphatic system, I for integumentary system, C for cardiovascular system, R for reproductive system, U for urinary system, S for skeletal system, E for endocrine system, N for nervous system, and D for digestive system. Okay, so you make a chart of all organs in each system in order. Okay, so from where it starts like this, one example I will show. So digestive system start with oral cavity, pharynx, esophagus, stomach, and up to the anus. You make like an order like that. That is the first chart. Then make a list of regional organs, like organs present in the thorax, then in the abdomen, pelvis, cranium, etc. So the second chart will be like the organs present in each regions of the body. Then in case of abdominal organs, you know that 9 quadrants or 9 regions of abdomen. Make a list of organs present in each quadrants. With this, you can write the introduction of any organ, like it is the part of this system, where it is located, and in which quadrant of abdomen it is present. All these introduction you can write. This introduction is very, very important in exam, right? Because first impression is the best impression. Then from each system, make a chart of measurements of organs. It is not an easy task, but once you complete that, sorry, but once you complete that, you can make another list of organs with hello?
Yes, sir, it is audible.
Yeah, yes. So you can make another list of organs with almost same dimensions. So first make a list of each organ like you already made a list of organs of each system. Along with that, or another chart you can make each organs having the measurements of each organs. After making that, you can make another list of organs with almost same dimensions, like some organs with within 1 to 5 centimeters, and some within 5 to 10 centimeters, and some in millimeters. Actually, it is not easy. You have to check the each notes and textbook, and you have to make this. So once you make this, it will be easy for you to understand. So like that, a comparison will help you to remember the measurements better than studying organs individually. Fine. Then the external and internal features. For that, the very best way is draw and learn. Here, the other issue comes for most of the students, like I don't know to draw diagrams or I don't have drawing talent. Here, I want to say something that no one will judge your drawing talent because that is not your concern. You are a medical student, right? And I felt like some students who are talented in drawing, wasting more time in exams for making the diagrams more beautiful and make it. So there are no need of such beautiful diagrams by wasting time in exams. You can show that talent in your notebook while studying. Otherwise, it's a waste of time you are doing because you have to write the points along with that. There's a half page diagrams. Fine. just convey your knowledge with diagrams. That is important. Okay, so the examiner should know you know about that organ. Okay, it should be somewhat looks like that organ with proper labeling. Okay, that's it. So draw diagrams, label each parts and learn the structure. If you are interested to draw or not, that is, if some are like, I can't draw the I can't because I don't know to draw even a line. Okay, that's not important. Whatever you are interested or not, you have to draw this diagram. Then only you will get marks. Fine. Then we'll come to the blood supply. That's another major issue while studying anatomy. The blood supply is very important for organs and in exams, right? There are so many branches and sub-branches of arteries and veins present in our body. Even a small branch divided into sub-branches like anterior, posterior, superior, inferior, superficial, deep, etc. branches. So you'll get confused with that. For some organs with one or two arteries, will be easy to study. Like I think like something like appendix, like appendicular artery, then thyroid gland, like superior and inferior thyroid arteries. For studying such things, I don't think anyone having any issues. Fine. But when it comes to major large organs like heart, liver, stomach, eye, ear, nasal cavity, etc. These having so many branches, right? These are supplying by so many branches. You start thinking that what's the need of these many branches for this organ, right? If it was only one artery, it would be easy to remember. But the truth is, that's why we are alive, because because of all these artery supply only that organ is healthy and it gives a protection. Fine. So that is not for checking our memory. Then if a 3 mark question asked like artery supply of stomach, you have to write all arteries to get the full marks. But if you will be happy with 1.5 or 2 marks, there are some options like that is just a chart of major arteries. Like that's 1 second. Okay, here you can make, you have to know the main branches of the artery. So here you have to make a chart. But the thing is, if you have to get full marks, you have to study the each and every branches. Fine. So here you have to know this. Yeah, fine. So here one example of external carotid artery. Okay, its branches. So its branches are going upwards to the external part of the face. So here you can see the superior thyroid branch, ascending pharyngeal, lingual, facial, occipital, posterauricular, maxillary, and superficial temporal branches. So here you can make a chart like this. Okay, so external carotid is passing upwards. From there, these branches. So here you have to learn this many uh, arteries properly and the area of distribution of these regions. Like you know that the facial vein is passing towards the face, that the buccal regions and all, and everything you have to make a list of the distribution also. Fine. Then you can make the same way you can make the chart of other main arteries like subclavian, descending aorta, abdominal aorta. So abdominal, if you know the branches of abdominal aorta, it is like you can see it here. The branches are going to, the first one is the celiac branch. From there, this region, you can see the hepatic artery, left gastric artery, and splenic artery, everything is passing. Then going downwards, so you can make a list of this. From that only we know that the renal artery is present there, right and left renal, and inferior and mesenteric artery. Fine. So like that, you have to make a chart. Next major issue studying the nervous system. It is not a simple issue because it is really complicated. And the truth is, our brain itself is not enough to understand its own unique structure and pathways. If you start studying the brain and spinal cord without knowing the introduction of nervous system, it is like just watching a movie from the second half. You won't understand anything without knowing what is neurons, its classification, then the gray matter, white matter, nuclei, ganglion. So you should study all these things first, then only you can go to the structures like what is midbrain, what is medulla oblongata, and what is the structure of the spinal cord. So here there is no shortcuts for this. First you have to study in order. You should start with uh, basic that in introduction and classification of the nervous system. Okay, after that go to the what is neurons, neurons classification, then study about the gray matter, white matter, then the what is nerve, what is tract. Okay, after everything you can go to the structures. After spinal cord you can go to the spinal nerves and then go to the brain region. After the brain you can go to the cranial nerves. Okay, so here there is no shortcuts because you have to study that in order, then only you will understand. And the nerve supply of organs. Okay, so in the nerve supply, main issue like I think no one having problem with the parasympathetic supply because there are only 4 parasympathetic ganglion present in the head, which supply by 3 cranial nerves. And you know from almost all the thoracic and abdominal organs are supplying by the vagus nerve up to the right to two-thirds of the transverse colon. And after that, the lower GAT and the pelvic organ supplying by S2, S3, S4, that is the pelvic splanchnic nerves. So here, if you draw this diagram, and otherwise we can make a chart with this diagram, it will be fine. Okay, next about the sympathetic system. So here, the sympathetic system is little difficult for students. For that, you can make the use of this diagram. Okay, so here you can see we're showing which and all spinal segments from T1 to L2 supplying which and all organs. So you can make a chart of this. Okay, from that you can understand from which spinal segment the sympathetic supply is passing to which organ. Okay, next the course of cranial nerves. Okay, there's other issue comes with the course of cranial nerves because the large nerves like facial, trigeminal, it is difficult to understand and make a chart of that. Fine. So here you know the trigeminal nerve first, then it will go to trigeminal ganglion. Fine. Then make a chart like this. It is divided into 3 branches: ophthalmic, maxillary, and mandibular. The ophthalmic, you can show the course of that. It is passing through the cavernous sinus and entering through the superior oblique, this orbital fissure and reaching that eye. From there it's supplying the superior one-third of the face. Next you can study about the maxillary nerve, that's also passing through the cavernous sinus and through the foramen rotundum, it reaching the pterygopalatine fossa, right? From there it's supplying the middle one-third of the face. Next one is mandibular nerve. It is passing through the foramen ovale and supply the lower one-third. Okay, so better you can make a chart like this for everything, better than writing full essay like answers. You have to convey with your charts. Fine. So start with one introduction. Then you will go to which are the nuclei. Okay, the nuclei of that nerve. Then you can go to the course of that nerve. Then you can write the apply anatomy of that. Fine. So this much points are enough. So you have to make like a chart. Fine. Then the next point is how to approach syllabus. Most of the students will get panic attack after seeing our vast syllabus, and that time only they close the books mostly. And some will start with full enthusiasm and stopping halfway. So better than studying the full syllabus from up to down, you can make it as a you can compare the topics and study. Like here you can see we have both Ayurvedic and modern topics are there, like Brahmacharya Samshodhana with preservation of cadaver. Then you have to study at the same time. Okay, so then you can compare both these and you will understand more. Then Asti Sharira with osteology, Sandhi Sharira with arthrology, and Pesh Sharira with myology. Then Sira Dhamani Sharira with the veins and arteries. Then Indriya Sharira, in that we have good references about the eye, the Netra Sharira. Along with Netra Sharira, you can write, in the exam also you can write some 2-3 points, right? Like if a question like heart, they say it's like heart, the first 2-3 lines you can start with some shlokas, like you studied about Hridaya Marma, Sthaneyor Madhyamadhishtaya, that shloka. You can start with that just to give some impression. After that, you can go to, it's not fully, you can start with that, right? So if you know the both thing, you can use it somewhere, like Uttamangya Sharira, nervous system. Okay, so you can use like that. Then, okay, here. So while studying the tongue, okay, like for example, when you are studying the tongue, anyway, studying its structure, its internal structure, external structure, everything you are studying. Along with that, the tongue muscles, the lingual muscles also are completing along with that. And after this, you can go to its nerve supply. Okay, so all these things don't, like if you are studying the nerves separately, it will be difficult. So along with one organ, anyway, you study the different types of cranial nerves, everything. So along with the tongue only you finish, you can see that lingual nerve and passing through the coda tympani, everything you have to finish. You can finish around 3 cranial nerves also along with that. Also, you complete the nearby structures like the salivary glands and its nerve supply. All together, you can finish. The same thing in the eye anatomy also. Along with eye, you can study about all the eye muscles. Along with that, you can finish around 4 cranial nerves. Fine. So like that, you have to compare and study. Okay, so there should be a connection between each organs. In the starting, you can't do that because in the starting we are studying in system wise. But it comes to the end of the syllabus, you can study like this. We can interlink and study. Fine. Then the last point. Then the last point is an usual query by many students to teachers during the study holidays, that which are the important questions for exam, and that will be the most irritating question for a teacher, right? And some teachers will reply like, if there is such important questions, then what's the need of this syllabus? We can teach only this important topics, right? Actually, that is the correct answer of that, because there is we can't avoid any topics. If you check previous 5 to 7 years of question papers, it will cover the whole syllabus, right? So if you check that question papers previous, you won't get even a 1 point without coming in the question paper, right? But for the purpose of this, we will be sharing a well categorized question bank, okay, shortly. And in our website, it will be available. So, uh, so I am concluding the section. You can post your queries in the chat box. Thank you.
Good afternoon, one and all. Myself, Dr. Manu Krishnanki. And in the previous sessions, we have discussed regarding all the techniques that we can use to study the anatomy in an easy way, isn't it? And we have seen how the syllabus can be cracked down. We have seen how you have to incorporate new techniques to study it is in flowchart forms. We have seen many other methods how to crack down our syllabus into smaller topics and how to approach it as the exam is near. So my duty is today like to give a lecture on how to present in an exam paper. So there are certain things that you have to always keep in mind while writing an examination that will help you to score better. So let's directly go to the session. So kindly wait for a while. So let's begin with the session today. So I'll be explaining you regarding the presentation techniques that you can utilize to improve your presentation skills and score better. First of all, I would like to say there are no exam cheat codes. There is just two methods to crack the exam, that is the repeated learning process and smart writing. So you'll be having a doubt, what is repeated learning and what is smart writing? So let's begin with this repeated learning process. It's an inevitable part as you can't learn everything together. As in the previous session they have told, the anatomy is a huge subject. It's a very vast subject, which is having a lot of syllabus points to read. So it can't be learned all of a sudden, like in a matter of 2 months or 3 months. So it's a repeated process where our short-term memory will be converted to a long-term memory by repetitive learning. And even if you learn repeatedly, there is another hurdle to cover. That is the smart writing. If you don't present the right things what you have learned, then you can't score better. And there is a saying like slow and steady wins the race. But the fast and smart wins the exams. So that's the thing that you should always remember. Slow and steady wins the race, but the fast and the smart ones wins the exams. So let's see what are the points you should always remember while doing a exam writing. When scribbling down your answers, always set it in an examiner's point of view. The thing is that you should always think in the perspective of an external examiner who is correcting your paper. So you have to filter out the parts which is written on the blind spots. And what are blind spots? When you just write down a note, sometimes when you are reading fast, you will miss out some points you have written in huge paragraphs, isn't it? So the same thing will be happening when a paper is being evaluated. So the problem arises when you bulk up your paragraphs. The examiner also feel tired to read all those things. So it's your duty to present in such a way that it should be filtered out to the minimal parts and it should be presented in a well-oriented manner. So it will be easy for the examiner to appreciate it. So that's the easiest technique that you can incorporate in your exam writing skills. So let's discuss how we can avoid the blind spots in your answer sheet. So the first and foremost thing that you have to remember is the numbering of the answers. Now many universities, they have a prefixed exam answer book where they have pre-typed letters, like pre-typed question numbers with each allotted pages for each of the questions. And that solves the problem to one extent. But there arises another problem. When you are blacked out during the exam, when you are in a panic situation, there is always chances that you can jumble up the questions. You might jumble up the sixth question to the seventh one, and there lies the trouble. If you write the sixth question on the seventh question number area, what will happen? Eventually, you lose two questions. And that's very important thing in case of anatomy. To score 50%, it's a very difficult task. So there is no chance that you can miss out the questions. So always remember, the numbering of the answers is a very important thing to remember. The second one is that you should always make sure that you have a structured answering template with the proper headings and titles, subtitles, so that the examiner can easily go through your structured answer and they can evaluate it. So rather than just mugging up something and just giving off all the things that you know onto your exam paper won't give you marks. What counts is that a well presented answer in a structured manner. And the third most important thing, the handwriting. So you already, I can see some frown faces because almost 70% of the students is having trouble with the handwriting, isn't it? And the biggest villain of all is the handwriting, which is the typical doctor's handwriting. So we have always used to joke on our friends who is having very bad handwriting that you are going to become a doctor in the future, isn't it? So, how can we change that? Is it even possible? We all know that our handwriting is an entity which is molded over time from your school days, isn't it? And it cannot be changed. I repeat, it cannot be changed. Then what we can do? What are the possible solutions to solve this issue of handwriting? So let's discuss how to solve it. So that can be solved by a particular kind of techniques and writing styles. It is not an easy task, yet through thorough practice, I'll be providing you with some few templates to structure your answers. I repeat, it's just a structural framework which you can use to present your answers in a well arranged manner. So, and that will make a huge difference. You can feel that in your answer sheet, and once you get the results, you will come to know how it helped you out. So, the whole questions of the anatomy can be grossly classified into these categories. They are the organs, the vessels and nerves, the glands, ligaments and muscles, osteology, arthrology, general and specific Ayurvedic topics. So these are the things that we usually come across in the examinations. So you will have an idea about how to present each type of these questions and what are the templates that we can use. So let me start with the first one, that is the organs. So I'm giving you a structure here, and you can see through these headings, and this will be your structural framework on which you can include your knowledge and present it in a proper way. So the first one is the introduction that you have to give, a proper Sanskrit name for the organ. Then we can add the Ayurvedic description in a short note if it is available. Then you can go for the dimensions where you can include the shape, weight, etc. Then the location, which is very important. First of all, you have to define the location of the organ where it is present. Then comes the most important part of anatomy answer, that is the diagram. So when it comes to the diagram, these previous three headings will cover almost one page. On the second page, when you start, try to draw the diagram in a very simple manner with a neat labeling, and that should cover up to half the page. So some people, like some students, they will try to cover up the page by drawing bigger diagrams. That is not the right way to score. And that will give a very bad impression on the exam. So always remember, a neat and properly labeled diagram in half the page of the second page is an ideal location to allocate it, followed by the structure where there will be, like, according to the organ, there will be surfaces, there will be borders, parts, which includes the external and internal features, then the blood supply, nerve supply, lymphatics, and clinical anatomy. So in the previous session, we have seen how to memorize the different arterial supply, like how the branches are coming over to the organs. So by that method, you can learn them and you can just fill up the blanks as if by using this particular template. So that is the whole idea of the template. Here I'm just providing you with an example where I have explained regarding the trachea. So you can see here, I've given a short introduction, followed by the location of the organ. Then I have incorporated the dimensions where everything you can just appreciate that I haven't written a single paragraph. Everything what I've written is single sentences with minimal words. And you can appreciate my handwriting. It's not at all good. I know that. But still, this is the way how you can modify it and you can present it in a legible way. Then I have included the extent of this particular organ. from which level to which level it exists. Then we have the structure here. It's a fibroelastic wall, like that description in a short way, as in flowchart form. And finally, the arterial supply, venous drainage, and lymphatic drainage. So, in short, if you write this much, you can cover almost 2 pages. And the other half page that is left is for the diagram. I have left the space for the diagram here. So the diagrams, you have to find out different sources where they will depict like the different ways to draw the simple diagrams of the anatomical structures. So you can just watch the links. You can find different YouTube channels where you can find easy drawing methods and all. That can be incorporated here. So I'm not discussing how to draw. That will be dealt in a following session if you want that. Then we have the vessels and nerves. And the template for the vessels and nerves is in this following pattern, where we have an introduction about the vessel, then the location of the vessel, followed by a short diagram where you can depict the parts of the vessel and the branches if you require. So that can be either in a diagrammatic representation or like you can just get some lines and they can join them together as we have seen in the previous session. That method also you can produce. That is also conveying. Then we have to explain the extent, the origin point and the end point of the vessels, the course, branches, and relations. So here we have an example of the axillary artery. Here you can remember, I've used a short introduction I have given here, followed by the location. The diagram you can include by just seeing out different links. Then we have the extent of the particular artery. We have the parts which is explained as flowcharts. Instead of writing, it has got 3 parts. There is a first part, second part, third part. It will be more conveying if you present in this format. And later, you can elaborate each of them. Here, the first part I have elaborated as the superior or proximal to the muscle. And that is nothing but the pectoralis minor muscle, so that you can just improvise. So this is just a model for you to get the structural arrangement of the answer. And here I have included the branches of axillary artery, where you can see there are 6 branches. I have divided that into this particular table so that it will be easily acceptable for the exam. And you can individually present the further branches here. And just observe the thoracoacromial branch. I have incorporated the further branches of the thoracoacromial trunk. And here you can see I have put the first letters in bracket A, B, C, D. That is another technique in which you can, with which you can remember the anatomical structures in an order that is called as the mnemonics. So with the help of mnemonics, you can actually remember the particular words. So here thoracoacromial trunk, if you remember like A, B, C, D, or you can say A, B, C, D. A stands for the acromial artery, then P stands for the pectoral, C stands for the clavicular, then D stands for deltoid. So this is also an easy way to memorize the things that you can incorporate in your studies. So this concludes the presentation of this vessels and nerves. Then we have the glands. So I'll be directly going to an example here where you can see I've taken the thyroid gland. So the introduction has been given, where I've incorporated the Sanskrit name of that. And there is a location, extent from word to word it extends. Then we have to draw the diagram, followed by the dimensions, where I have incorporated the weight and the dimensions of each lobe and the isthmus. Then the structure you can see. The structure also I have explained in a single letter. That's growth structure and the histological structure. In the growth structure, we have the further classifications and see how I have incorporated that by the flowcharts. So the lobes, they are conical in shape. Then we have the parts labeled out, the apex, base, 3 surfaces, and 2 borders. And further, I have elaborated the same points here, the surfaces into 3 types, then the borders, apex, and the base. And finally, when you are explaining a gland, it is very important to include the histology. Which cells does it constitute? So that also has to be specified in a very short way because it's functional aspect that will come under the Kriya Sharira. Then we have the usual chart, that is the arterial supply, venous drainage, lymphatics, and the nerve supply. The next one is the muscles and ligaments that you already have covered in your dissection cycles. You might have studied the different muscles of the upper limb, lower limb, etc. So it is more like a fill in the blanks. You have had questions in your small childhood times, like fill up the blanks. So here you have these particular headings where you can fill up the points. For the introduction, you can say it's like a muscle which is in fusiform in shape and it is present over the particular area. So I'll give an example: biceps brachii. It is a muscle which is located in the upper limb. That can be the introduction. Then the location, it is present in the arm region. And you can give a small diagram representing the shape of the biceps brachii, followed by the type of the muscle, which type it belongs to. It's a striated muscle, isn't it? It's a voluntary muscle. That also you can mention. Then the origin and insertion. The origin points, you can see it has got two heads of origin that arises from the tip of the coracoid process and one from the supraglenoid tubercle. That will define the origin. Then we have the insertion, where you can say it is inserted to the radial tuberosity. So that will come out the original insertion. Then we have the action. It helps in the flexion of the elbow joint. Then we have the blood supply. That and all, you have learned the techniques to study that particular blood supply, how it comes to that particular area. So like that, you can fill up the blanks. So it's very easy to remember. If you have this template, you don't have to think twice. What all I have to write about these muscles. Okay, so the same thing is applicable for the ligaments. They can be asked for short answers. So the next one is osteology. When you appear the osteology questions, when you are defining a bone, you already know that we have many textbooks available which really have these kind of headings, and they have classified it in flow charts. They will be having bullet wise, like they will explain all each and every points in single sentences. So you can approach the same textbooks and you can just incorporate that in your paper. So I am not explaining further on the osteology aspect because you already have that. Here I have shared the template for that, where we have an introduction, location, and when it comes to the types of the bone, you have to incorporate the Ayurvedic aspect as well. So along with the modern point of view, the type of bone, it may be long bone, short bone, or sesamoid bone, or anything like that. But you have to incorporate the Ayurvedic aspect to it, whether it is a Nalakasti or Valayasti, that you can just mention as a single line. Then you have to define the parts of the bone, followed by the diagram, which is having two aspects. In case of humerus, if you take, you have to explain the anterior aspect as well as the posterior aspect. Then we have the external features, surfaces and borders, other characteristic features, blood supply, nerve supply, and the clinical anatomy. So you have to write down these templates and try to just take up that into your head so that you will have a framework always in your hand. You just have to fill in the blanks on the answer sheet. That is the easiest way you can present what you have studied in a proper structured manner. The joints also comes under, like, it has been well explained under the Ayurvedic concepts, and it is well explained in the modern concept as well. So you have to incorporate both of them if it is coming for a short essay question or a long essay question. Otherwise, if it is a short answer question and they are asking like explain the shoulder joint, the ligaments of shoulder joint, you don't have to explain all this. These all are templates which you can use in general, which can be cut short and which can be elaborated. So that is the acceptance of these templates. So you have to always keep that in mind. Then comes the difficult task, that is the Ayurvedic topics and the general topics. It's very difficult to explain these topics because they are widely varying from each other. So I'm just giving you a like rough idea about the presentation techniques that you can use for the Ayurveda topics. So whatever we have discussed in the previous slides, the same things I am incorporating into the Ayurvedic topics. So here I present to you one example of Asti Sharira, where I have incorporated the first heading, that is the etymology, that defines the nirukti of that particular word, followed by the definition in a single line sloka. And you can see I'm not writing more than 2 lines of sloka here. I'm splitting them up and further elaborating on them. And here you can see the simile used to describe, sorry, pardon me. Here you can see the simile used. I have been describing it not with the sloka itself. Instead, I have made into a flow chart and I have explained it here. So like this, always remember when you are writing a Sanskrit term, don't use English words or English letters. Always try to follow the Devanagari, the Sanskrit itself. So the answer will have the particular look. Okay, here I can write the Sharira Dharana as in English words also, but it's not ideal to use the English letters to define the Sanskrit words. So always try to keep that in your mind while answering. Always use the Sanskrit words. Even if you don't remember the sloka, try to just remember the important parts of the sloka and write that down in a flowchart. Here, the types of asti I have it explained in a flowchart manner, where you can see etani panchavidani bhavanti tatyata kapala ruchaka taruna valaya nalaka samjnani, where I have divided it into the further classification, and in single line sloka I have incorporated the same. And always try to bubble the major headings so that it will just strike the eyes of the examiner, and that will provide you more chances to get more score. So that is like an easy cheat code. Like whenever you are presenting something, always highlight it with bubbling or some underlining techniques. So this defines the Asti Sharira. And here I'm explaining another concept, that is the Mrida Samshodhana. In the previous session, we have discussed like we have to compare and study the embalming technique and Mrida Samshodhana Vidhi, isn't it? So the Mrida Samshodhana Vidhi, I've explained here in the flowchart manner. So you can see the same particular sloka has been split up, and the meaning of each line have been split up into flowcharts. So in being an anatomy student in the Ayurveda course, there is no easy way, like you have to study the slokas. If you can't read that much of slokas, at least try to just pick up the correct splitted up parts of the sloka, which can be presented as Sanskrit words itself. And that can be utilized to present it in a good manner. And here we have the dissection procedure or the Mrida Samshodhana Vidhi explained in steps. So usually you will see just the sloka. So try to split the sloka into these 3 types. So we have divided it into the selection of the cadaver, the procedure of preservation, and the procedure of dissection. So it's a continuous sloka which I have split up here to explain as the steps of dissection technique. So like if you present in this way, they will we will be thinking in our point of view that you have thought in a real logical manner and you have splitted up the slokas in such a way so that you have studied well about the topic. That gives a good impression on the examiner's side. So always remember that. The continuation of the procedure of dissection or the Samshodhana. Here you can see I have splitted up the sloka into small lines. Only the respective parts I have incorporated in each lines. So the Kodhana Vidhi, then followed by how many days you should keep that body in particular stream of water, and followed by how you have to do the dissection. So that has been dealt, and you can see a lot of Sanskrit words here while I'm explaining it. So that gives a good look for your answer. So always remember to present in this way. Then we have the embalming techniques here. So the embalming is the corresponding part for the Mrida Samshodhana Vidhi. So when you compare and study that, so you can follow this kind of presentation where I have, like you can see there is a definition for the embalming, which you can collect from various textbooks. Then you can write down the volume to be injected. Then we have the composition of fluid, which has been decoded into further small, small headings. So this defines how clear the idea is for the student. So that gives you good marks. So this here you can see the composition of the like preservative fluid is the formalin, which acts as a preservative. Then we have buffers, anticoagulants, moisturizing agent. We have germicides. We have a vehicle. Then we have the fungicides. So this clearly defines how deep you are studying the subject. So even if you have studied this thing and if you are writing this in a paragraph, it won't give you good marks. And here you can see the types of embalming I have made into a flow chart rather than writing in a sentence. And I have further elaborated each points below it. So this is the right way of presentation. Excuse me. And the final thing that you always have in your mind, how do I manage the time when it comes to the examination? I have studied everything. I'm trying to present everything what I've studied, but I'm not getting time for that. All the time when I'm about to reach the 3 hour mark, still I'll be having 2, 3 questions left. The problem lies in how you divide the time for each questions. So there is a general pattern of questions, like we'll have long essays, we'll have short essays, and we will have short answer questions. So the dividing the time for each of the specific questions is a very hectic task. And while writing the examination, you won't be remembering about the watch or the time that is being moving along with the writing. You will be always just looking at the paper and you'll be worried about some questions that you don't know. So let's stop here to just see how you can divide the time. So the total time in hand for you to write an examination is 180 minutes. That is 3 hours. So the actual time in hand will be 10 minutes less. We will lose 10 minutes over turning the pages. You'll have some areas to fill up. Then you'll have some diagrams to draw. You'll have labeling to do. All those things will take up 10 minutes. And when it comes to long essay, the maximum time you can allot for a long essay question is 25 minutes. So remember, if there are 2 long essay questions, that will consume a total of 50 minutes, isn't it? And followed by the short essays, where you can spend a maximum of 8 minutes each. That counts 80 minutes in total. And the short answers, the maximum time you can spend over it is 2 to 3 minutes. And that will consume your 30 minutes. Just count it down, it will come to 160 minutes. Still, you have 10 minutes left. And that 10 minutes is for you to recheck the answers to see whether you have left something behind, or if you have left a question after 25 minutes to complete the other questions, you can go back and write it down. So when you are writing the exam, start with the long essays, finish up in the maximum time, that is 25 minutes. And if you can't finish it on time, go for the next question and try to make up the time and use that final 10 minutes which you have left, that you can utilize for writing the remaining part of long essay. And that is a particular pattern you have to follow when you are in an exam. So if you don't follow that, you will have the time mismanagement and you won't be able to attend all the questions. So when it comes to the exams, attempting all the questions is the most important thing. And this is the pattern how you have to approach each questions with the timings. So by this, I'm concluding my session on the presentation techniques. And if you have any further queries, you can just put that in the chat box and I will be answering them. Thank you.
One question is there, and to give an example for a diagram.
Diagram. So I'll do one thing, like have they specified any particular topic?
No, any diagram is
Any
fine.
diagram is fine. Okay. So all of you can, I'll be sharing the screen now. So I think you have already covered the topics regarding the neuroanatomy. So here, I'll be just drawing down a simple diagram to show how the sulci and gyri are present on the cerebrum, on the superolateral surface of the cerebrum. So herewith, I'm just drawing the diagram. Here, I'm drawing the cerebrum here. Drawing this much is not a big deal for most of the students. So you can see this represents the cerebrum here. And I'm just drawing the major sulci which separates it. So here we have the central sulcus, we have the lateral sulcus here, then we have the parieto-occipital sulcus here. So these are the basic things. So when you see the diagrams in a three-dimensional manner in Totora or Chaurasia, it will be difficult for you to reproduce that on the paper. So always, when you search for the diagrams, don't just count on to your textbooks. You have a lot of other options. You have access to a lot of like platforms where you can find the easy way to draw the diagrams, and you can find many diagrams in the Google itself, and try to find out the two-dimensional diagrams and draw it down. And that is the easiest way you can learn how to draw the diagrams. So here, and there is no such thing that you should be very perfect in the drawings. If you draw a particular diagram, it should be neat without much corrections. And always remember, when you are labeling down, these are the things, like I'm just marking down the lobes of the cerebrum. Okay, so the labeling should be always like this. I'm marking down the frontal lobe here. Then we have the temporal lobe here. Then we have the parietal lobe here. Then we have the occipital lobe here. So the particular labeling lines should not be overlapping each other, and that should always be in a single line. You can see here, I've put a margin here, and every particular labeling comes in a straight line. So that gives an appealing character for your diagram. So here also I've done the same thing. It comes in a single line. So always try to label the diagrams in this way. And if you I'll just show you what might go wrong when you are doing the markings. If you try to mark the same things, if you try to mark the frontal lobe and the occipital lobe here, it overlaps and it covers the whole diagram and it ruins a particular diagram that you have drawn. So never do that. So always try to remember the minimal part of the labeling line should be on the diagram and the rest should be outside the diagram. So these are the things that you should remember, and you can make use of the two-dimensional diagrams which are available on the internet. Thank you.